Hello, welcome to the Gout Support Group America Facebook Live event. Happy Gout Awareness Day to everybody. Tonight's theme is Back to the Future, Then and Now. My name is Gary Ho. I will be your host tonight. The purpose tonight is to honor Gout Awareness Day. We've brought some of the leading voices in the gout community to join us. Super excited to introduce you to them in a little bit. Tonight, we're going to revisit the origins of Gout Awareness Day, reflect on the progress we've made, and talk openly about what still needs to change. With that, I'm going to introduce our panelists. First, we have Dave Arntsen. Dave is a longtime patient advocate and a co-founder of the Lupus and Allied Disease Association. I've known Dave through our advocacy work, and I can say without a shadow of a doubt that he has an unwavering passion for amplifying patient voices across healthcare, policy, and research. And he does all this while living with gout for nearly 30 years. That's pretty amazing. Dave, would you tell us a little bit about the Lupus and Allied Disease Association? Why did you pick lupus?
Well, I didn't pick lupus. My wife picked lupus because she has lupus. 30 years ago, she was diagnosed with lupus and ended up taking on roles with a local organization. Now she is the chairman and CEO of the Lupus and Allied Diseases Association, the third national organization in the country. Through that, I have supported my wife. I had my own career in education. About 6-7 years ago, she was doing presentations on helping patients understand the disease and getting them interested in participating in clinical trials. I said, these wonderful people coming with these lupus patients aren't getting anything. So I started a caregiver presentation, and it was received well by the significant others. It's not always a husband or a wife. It's just whoever is that other person in your life. I did not pick lupus. Lupus picked me. As I worked with Horizon developing Krystexxa, I was able to become involved. It was my pleasure to get to know you and many other people through that opportunity.
Next, we have Dr. Larry Edwards. Dr. Edwards is a distinguished rheumatologist from the University of Florida, widely regarded as the godfather of gout in the medical community. With decades of clinical experience in gout treatment research, Dr. Edwards has established himself as a master of the American College of Rheumatology and a renowned clinical trialist. He founded the Gout Education Society in 2005 and played an important role in establishing Gout Awareness Day, demonstrating his deep commitment to patient education and advocacy. His passion for bridging the gap between patients and healthcare providers has made him a powerful voice within our gout community. Beyond his academic achievements, Dr. Edwards has dedicated significant time to public education, including hosting Reddit's Ask Me Anything session and participating in Facebook Live events to reach patients directly. He collaborates closely with organizations like the Gout Support Group of America and the Gout Education Society to ensure people living with gout has access to information and proper care. Dr. Edwards, welcome.
Thank you, Gary. That was quite an introduction. We can talk about the origins and the purpose of Gout Awareness Day. I think it has been an important part of the calendar to renew our efforts to make sure that gout is understood well by the general population. There's a lot of ignorance and perpetration of myths that need to be changed. So that's been our role.
Would you tell me a little bit about the Gout Education Society?
This was a group that Ralph Schumacher was the true godfather of gout. He was at University of Pennsylvania, and he and I sat around back around 2003, 2004, looking at all the educational efforts we were doing to physicians, usually at steakhouses tonight, and we're not satisfied that we were making much of a dent in how well gout was treated around the country, and thought that maybe giving the power to the patients by having a website that had good scientifically based approach to how to manage gout, have the patients understand that they could go into their physician's office and say, this is how I want you treated, and here's the reference. We had been fomenting this idea of a gout education society. Once we did that in 2005, one of the first things we did was to say we need a date on the calendar where we can make a big deal out of this through our website. We submitted a petition to the national group assigns special days of the year. We picked May because it's Arthritis Foundation for a long time has used that as National Arthritis Month. It would fit well in that. And it's also about a half a year away from the other place on the calendar where we were going to get a big hit of excitement, and that was the American College of Rheumatology's annual meeting. Ralph and I went through the whole calendar, especially in May, and ended up picking the 22nd. The only thing we had to compete with on May 22nd was Sherlock Holmes Awareness Day.
Thank you for that, Dr. Edwards, and thank you for being here. Our next guest, Dr. Parker. The Gout Support Group America, GSGA, affectionately knows him as Dr. P. So Dr. P, he's a graduate of Kansas City University of Medicine. He completed his residency and fellowship at Walter Reed Army Medical Center, where he also trained in medical research and served in the U.S. Army. A board-certified rheumatologist for over 2 decades with experience and passion for putting patients first. Dr. Parker has helped shape national conversations around chronic diseases, especially gout, through his clinical work, public speaking, and research. He's known for his ability to truly listen to patients, helping them feel seen, heard, and supported. He's the co-founder of the Gout Support Group America and a longtime advocate for better gout education, care, and community. Chris, welcome.
Thank you, buddy. Appreciate being here. I'm really happy to be working with Dave and Dr. Edwards as well.
Chris, would you tell us a little bit about the Gout Support Group of America?
Sure. Edwards, when I was at Walter Reed and trying to educate other doctors and patients on the illness, that's what really got me most interested in gout, is how more experienced doctors than me had very different views on how to get people well. And we didn't even have very many drugs back then. So it really got me interested. When I left the Army in 2003 and started working here in Austin, Texas, I maintained my interest in gout, continued in research, and you and I met. You were, like a lot of people, getting beat up, but once you got well, and it was a dramatic change from guy in a wheelchair to kickboxer. It was an amazing metamorphosis. I remember you asking, why isn't there a support group? Breast cancer has one, diabetes has one, everybody's got one. Where's the gout one? There's so much folklore out there, a lot of false information. And you said, we need to make one. I said, I really can't imagine putting something else on my plate, and explaining to my wife how this is a good idea. We did start doing Saturday morning talks for patients locally. You really help with the electronic aspect of getting it on Facebook and getting it out to the world. It's really grown since then. I think it's allowed us to touch people all around the English-speaking world, particularly when we have, as our guest speakers here today, bring lots of, prestige and patient power to the discussions. Everybody gleans valuable information. I loved how that story intertwines with what Dr. Edwards said, the frustration of, man, we can't really get to people, so we want to bring this to the world using a different format. I'm sure we've touched a lot of people, his group and ours, over the years with this.
Thank you for that, Chris. All right, let's jump in. Our theme is Back to the Future, then and now. Let's travel back in time. You started telling us a little bit about the origins of Gout Awareness Day. What were you seeing back then when it came to gout with the gout community? Why did you feel the need to start a an awareness day for gout of all diseases?
The main one, Gary, was that gout is one of the most treatable of rheumatologic disorders. It doesn't take a genius, and it's not even that terribly expensive to do it. It remains one of the most poorly treated of all rheumatic diseases, of all chronic diseases for that matter. It comes from a lot of information that's been out there for years, decades, that was simply wrong. A good example of that was going back to 1985, an article suggested people with any level of chronic kidney disease should not be on a dose of allopurinol higher than 200 milligrams a day. About 10 to 15% of patients were going to get to the target of uric acid level that we promote now and make a difference in their disease. A lot of people were trying what their doctors would tell them, but they weren't getting anywhere. And so we thought that getting a source out there with some good information, we brought together a lot of the renowned gout people, including Dr. Schumacher at the time. And even before the first ACR guidelines, so we come up with an abbreviated approach to how people should look at gout, not a disease of overindulgence, not a disease of poor lifestyle choices, but really a genetic disease. It's a metabolic disease. It's a serious disease. And the problem is people just weren't taking it seriously enough.
I remember finding out about Gout Awareness Day when we first started our support group. I couldn't believe there was a Gout Awareness Day, and I was thrilled. I remember Chris and I had gone on some type of media tour just to talk about gout. So, I mean, it has affected our community in a very positive way. I think more people today know about Gout Awareness Day than before. We've accomplished a lot, but there's still more we can do. Have you seen any frustrations back then that are still happening to this day?
Frustrations, certainly, and on both sides. I hear frustrations from patients constantly. They stem from not finding their primary care physician just doesn't listen to them about the gout. They're more worried about their diabetes, high blood pressure, or coronary artery disease. And gout takes a much lower position on the ladder. They look around for a physician that knows something about gout, that likes treating gout, and they can't find one. Early on, we would get to the Gout Education Society. I live in Middleburg, Tennessee. Can you tell me where there's a physician that knows something about gout? Knew all the academic people, but I didn't know which rheumatologists or primary care physicians would have gout. And so we took that on at the ECR meetings, at the ACP meetings, just the practitioners and the rheumatologists, trying to sign them up to be on our gout specialist network. And we would place them on our website. And these are people that know something about gout. They pledge to abide by the American College of Rheumatology gout treatment guidelines. They're going to take some education about gout that they can pass on to their patients. And here they are down by states. And I think at our most recent tab, there's 880 rheumatologists that have signed up for that, which may not sound a lot compared to cardiologists that might have 30, 40,000. There's only a couple of thousand lists in the whole country. And this is a pretty good share of them that are taking this on. And patients can go to that section on our website and find it. We've eliminated one of the big frustrations. Physicians always complain that patients aren't getting better because they're not taking their medicine. Well, we know now the real problem is that patients haven't been educated well about the disease and looking out for themselves.
The impact of the Gout Education Society and gout awareness has been profound. The fact that you're able to get other rheumatologists to take an oath to a certain way of thinking, that's pretty remarkable to think about. And even Chris, who is renowned in the way he practiced, swears up and down with his oath through the Gout Education Society. We can see the definite impact over the last 20 years. Chris, from your perspective, what have you seen change over the last 20 years? Are you seeing better treatment options? Have you seen less stigmas? Are there more awareness now around the gout disease?
I share some of Dr. Edwards' frustrations, and I'm an optimist. Most, if not all of my frustrations that I had back in the 1900s, I still have. When I would do physician education in the Army, the title slide was always Gout, the Illusion of Simplicity. Docs in the Army would call each other. They would call for help from a rheumatologist because they're thousands of miles away. They would call me with complicated lupus patients, rheumatoid arthritis patients, vasculitis, all kinds of terrible illnesses. But I'm like, why don't I never get a call about gout? Well, it's so easy. You just lower the uric acid and it's no problem. Really? To Dr. Edwards' point about misinformation and doctors not giving good information, why is it that when you have a gout attack, you're telling your patients to stop taking allopurinol? How does that make sense? Edwards said that we're responsible for a lot of the misinformation, for patients not taking their medicine correctly, or being told that colchicine, an anti-inflammatory, somehow lowers uric acid. The lines are totally crossed. In the couple decades you've been doing this, do you think we've come a long way? Well, you're right, Gary. We do have more tools in our toolbox, but I still see patients just as sick as I did. Thank goodness there are people like Dr. Edwards out there really trying to get the Gout Awareness Day to the masses so that they themselves will say, hey, can I go see a rheumatologist? It was bad then and it's bad now. I'm saying, as an optimist, do I think we're making a huge difference? Yes. Can I fix people way faster than I ever could with my current tools? Absolutely. But there's still a bunch that need help. That's one of the reasons we're here. We want people to know there's lots of hope, lots of things that we can do. If things aren't going well, go to Dr. Edwards' website, find a specialist in your area, or just get another opinion. It's just an opinion.
Finding your voice and asking for that second opinion sounds so easy and simple, but it's a psychological problem.
Totally.
It's a battle within a lot of patients or a lot of people that live with gout. We battle this view. Should we fight back? Should we
Cultural construct that makes people think, oh, I don't want to ask for another opinion because I like this doctor. Or I do trust this doctor. It has nothing to do with trust. They completely believe they're doing right. Sure, you could trust them, but I just need another opinion. Other problems get prioritized above gout in the office because many doctors have this false perception that, well, gout's just an intermittent painful illness, but it's this diabetes is going to kill you. They don't recognize what's going on below the skin and how that can take away other organ functions. We're here with the Gout Education Society to help people understand this is a big deal.
You know, behind every scientific stats that we see report, there's a real person, right, living with gout. And so with that, I want to bring in Dave. What stands out to me, Dave, is that gout is the most inflammatory type of arthritis that we have. A few years ago, we tried to count. I think we were up to 12 million people and counting. It's probably way more than that, but I'll just be safe and say 12 million plus Americans have gout. Only 1 in 4 are able to manage gout successfully. With that, Dave, would you tell us a little bit about your journey, your struggles? We know that you've been living with gout for 30 years, and I believe, X amount of those years you've been living pain-free, but it hadn't always been sunshine and roses. There were some dark days. I think our audience would love to hear your lived experience with gout.
Oh, thanks, Gary. My experience started with the thorns, not the roses. I grew up with my father who had gout. Back in those days, they only treated the symptoms, not the condition. Over time, I was one attack every couple of years. I lived through it with, with anti-steroidals and painkillers. Then it got to 2 or 3 attacks a year. I was in my mid-40s, and I said, I can't live like this. So I went to my GP, who said, maybe you need to see a specialist. I found a rheumatologist, and unfortunately, she was not informed about the disease as much as I had hoped. She just went to the colchicine route, and that was a panacea, basically. But then through my wife's rheumatologist, who was exceptional, he agreed to see me. I had a uric acid of 8.6, and he put me on allopurinol, and he tapered me up from 100 to 200, and then from 200 to 300 over the course of a year or two. I was down to 5.3. Since that process, I've been on 300 milligrams a day, and I have had zero side effects. I love to drink beer. I love to eat hamburgers. I avoid high purine meats like bologna, hot dogs, and shellfish. Those seem to be triggers for me. But I have lived a pain-free, completely enjoyable adult life since then, all because of this one rheumatologist who really understood treating the condition, not the symptoms. I thought if I stopped eating red meat and I didn't drink beer, I could beat the pain, beat the attacks. That doesn't lower your urate levels. Go to a good rheumatologist, try to find allopurinol or another, Cristex is another option. There are other options, but lower your uric acid. Once you do that, life is good. If you're just a little careful, I liken it to type 2 diabetes. It's a condition that's treatable and manageable if you understand what you need to do. Same thing with gout. There's no reason why people should suffer. Dr. Parker's remarks, it's a condition that affects much more than just the large toe and buildup of uric crystals in joints. It affects all parts of the body. So get that urate lowering drug and you'll be fine. And enjoy a good IPA now and then.
Right.
That sounds amazing to hear your story.
I want to follow up on something, Gary, because there's still a lot of doctors, even specialists, will still put restrictions on foods and drinks as part of the management of gout indiscriminately. And I think it's so contrary to pragmatically living on earth. Having doctors focus on these dietary modifications as the primary foundational treatments of gout is as ignorant as going all the way back to what Dr. Edwards was saying. Those modifications are not going to change your genetics. It's a genetic illness. And I come from the same kind of family, dad, brother, grandpa. You can't just put an X on those things and think you're going to solve that genetic stuff. And I submit that when I tell patients with their spouse in the room, when I say, I'm not going to say don't drink any more beer or eat another steak, it makes no sense. We're going to lower uric acid with medicine. And the better nutrition you have, the less medicine you may need. No way cutting out dietary things is going to be a successful strategy by itself.
The dietary restriction topic has been around forever, even within my own personal journey. The stigma of gout carry stigmas, one of which is eating the right food, or if you overindulge, eat the wrong things. It basically, when you talk that way and think that way, it brings the fault back to the patient or the disease. I was in DC a few days ago. We did a congressional briefing on gout. One of the things I made sure our Capitol heard is that the stigma people deal with within gout, I liken it almost to a bad relationship that tells me, hey, it's all your fault. You're suffering because of what you're doing. It has nothing to do with me. You're stuck in this relationship that pounds you every day and you can't escape it. Over time, it changes your mental. Not only does the unmanaged gout affect you physically, it's the most painful feeling that anyone can go through when they experience a gout flare. Beyond the physical, very few people see the mental health connection, and it's real. The stigma day after day beats you down to where you think, wow, I might deserve the suffering that I'm going through. It's pretty powerful, profound.
I think that's about the underpinnings of gout. What are the factors that cause some people, even that have uric acids elevated, to get gout, while other people with high uric acids don't? The genetics of the disease has been unraveled by superb groups in New Zealand, at University of Alabama, and a couple of other places. But we now know that this is primarily a genetic disease, that it gets a little help from environmental things, like if you're overweight, it might make these genetic differences more important to the accumulation of uric acid. And I think that as we were seeing this, it did change everybody's thought process about how we refer to it. It's not a self-inflicted disease. It's a disease that's metabolic. It's a disease that's genetic. It's a disease that's chronic. It's lifelong. Therapies need to go on lifelong to keep it well controlled.
Those advances are slow, though, it seems like. You understand it's a genetic illness. Some of the medical community does. As a community-based rheumatologist, I'll say that I still, every day, hear the stories of patients being told, to Gary's point, it's your fault. You did this. You own it. I'm waiting for that genetic aspect to be internalized by the medical community. I want all the patients to say with great alacrity and delight,
when we talk about gout being a genetic factor, it doesn't matter how healthy you eat. I say that from personal experience. I tried hard eating what I thought was good. I read all the pamphlets from doctors I've seen through my 16 years journey of trying to find a diagnosis for this invisible condition. I tried and I failed every single time. So to hear it's genetics, it's real freedom. I feel just so free from it. And I really hope the people listening to this show right now, if you have gout and you are beating yourself up over this disease, stop. Stop beating yourself up. It's
That's wrong.
if you do have gout, most likely it is genetics and it can be treated. You actually can live with gout, because once you have gout, as Dr. Edwards have said, it's a chronic condition. So there's no going back. Once you've crossed that line and you have gout, it's lifelong, but it's manageable to the point where, like Dave was talking about, we can have freedom in what we do and eat and not be boxed in by fear of the unknown. We can be directed through data.
Just today at the conference here in Toronto, I spoke to a national leader of a research institute on lupus. The individual I happen to know now as a friend over these years, he said that I indicated that I will be doing this event today. He said, it's funny, was diagnosed with gout about 2 weeks ago. And I said, are you on allopurinol? He said, yes. He says, I tried to manage it with diet. I stopped drinking beer. I stopped eating red meat and didn't do anything. I said, exactly.
Classic.
Now, this is an intelligent person, but his wife said, oh, just stop eating red meat, stop drinking beer. It'll probably be better. I said, it's genetic. You were born with that issue, and it just took this long to manifest itself. Very well read and same issue as some guy over at the bowling alley that never finished high school.
I'm going to dominate the whole talk with diet, but to your story, have maximally educated Dave, that anecdote, and I'll give the anecdote of the highly disciplined people. There's people that say the average person can't do it with diet, but I can. I have several Olympic athletes in my clinic. These people are wildly disciplined and they can hold on to a diet and be strict. And they'll say, I can do it, doc. If you're going to be the first one in 25 years, be my guest. I say, I'm going to help you though. You dial in the diet however you want, make it as hard as you want, and I'm okay with that. But I'm not going to guess. Let's just check your labs every 2 to 4 weeks. When you come back to me, either you're a success story or you're not. Everybody comes back with their head hung low saying, ain't no way I can live like that, and it didn't even work. Do you have those guys too, Dr. Edwards?
And I understand the low purine diet because we used to do research on that. All the patients would be stuck on that. I was a normal control for that group. And your low purine diets for 2 weeks was part of this. I'm delighted that you got to a good target level of uric acid, less than 6. That is what we shoot for in everybody. Even lower will help you. The fact that you did it with only 300 milligrams of allopurinol is good, but most people require more than that. One of the great problems in this country is that 96% of the prescriptions written for allopurinol are 300 milligrams or less, whereas the mean dose that's required is about 450, almost 500 milligrams. So 60% of people aren't even getting the dose they need. The FDA approves the drug up to 800 milligrams. We just don't test the bounds of that drug well enough to get people to where they should be and get the effects P has been described.
One of the interesting things is that the pharmaceuticals are only offered in 100 and 300 milligram pills. My doctor wanted me on 400. The pharmacy would only give me one script. They would not give me two scripts. So I said, well, why don't you give me two 200s? They said, we don't make 200s. I was in for a while, a 300 milligram one day and a half of a pill the next day. So it was 300, 450, 300, 450. And then we finally decided, let's just try 300. And I maintained a 300. Like you say, 400 is probably the target for most people. And you can't get 400 milligram allopurinol pills.
It actually makes me sad hearing that, because I remember when I was taking allopurinol, I had worked up to 150, and that was my dosage. Like you say, Dave, it comes in 100 and it comes in 300. So, what I did was I did a 300 and I broke a 300 in half. And to get pushback from a pharmacist, it doesn't make me feel good. It actually makes me quite upset, because we're talking about patients' quality of life. For a pharmacist to come between the relationship of their caregiver, a professional rheumatologist overseeing a chronic disease. I see that more and more now in the world that we live in, and it's quite frustrating.
My wife fought a huge battle with New York State legislators about step therapy and fail first. We were talking to the legislators, and I was looking at the list of diseases under the umbrella of fail first. You're not going to believe this one. Pregnancy was. They said, you can't get the pill until you try these other two things. I said, well, what's a failure if those don't work? Well, it's a pregnancy. It's an unwanted pregnancy. That was immediately processed by the legislators, and we move forward with step therapy reform, which is important. I think we have to educate legislators and politicians as well as patients. And it sounds like rheumatologists from time to time as well.
The dosage is a real issue. Within our support group, we hear day in and day out people saying, allopurinol is not working for me. And of course, someone will ultimately be asking, well, what's your dosage? It's 100. This conversation comes up often where we say, I'm not a doctor, but if you talk to a rheumatologist, they probably would tell you that's an introduction dosage. You're going to have to work with your physician to find that right balance. I feel there's a lot of room for educating not only patients, but physicians, and building confidence in them to know it's okay to up that dosage a bit. I wonder, Dr. Edwards, how many physicians actually know you can go up to 800 milligrams of allopurinol and be safe?
All the people on the Gout Specialist Network are on our website know they can go up to 800 milligrams, because that's the recommendation of the American College of Rheumatologists. I tell my patients, once I am dose escalating and getting above 300, if your pharmacist gives you any pushback, here's my card, have him call me directly to read in the justification in the literature for this, so they won't keep blocking those prescriptions.
I can't imagine how frustrating it must be for you guys.
In fact, I love getting those calls, because I say, if you think you can do it better than me, by all means, you can take over. If you can do it better, I'll sign off. They never do, of course, because they can't prescribe. I'll also say, to Dr. Edwards' point about the FDA recommended max is 800, but out here in Texas, we can grow them pretty big, right? If you're a really big guy, they don't buy their clothes off the rack. I sometimes have to use more because they're just big guys. 3 of the 300 is 900. Fine. I got people on that. Take 4 is 1,200. They're that big. The prescription is going to go from $12 for 3 months to $20. It's that cheap. To Dr. Edwards' earlier point, this is not expensive to take care of. Whether you have diabetes or gout, you need to use as much insulin or allopurinol to control the illness.
How about the numbers, Chris?
The right dose of allopurinol is the one that gets you down to the target.
Where do we go from here in terms of past, present, and future? kudos first and foremost to the Gout Education Society in getting people to say, yeah, I will use the right amount. Everybody's got a different right amount, different size, different shape, different genetics to get there. We need to understand what that target is. The lab companies report that if you have gout, you need to be under 6. Dr. Edwards mentioned that, but it's worth repeating. These normal ranges, 3.5 to 7.4, you're good, but not if you have gout. It doesn't bother me if a primary care provider or other specialist doesn't have the same level of knowledge that I have in gout, because no one can know everything. I have a colleague who is a marvelous rheumatologist who has no interest at all in taking care of gout and crystal diseases. And so he'll walk into my office and goes, "We got another one for you." He'll tell me the story. Some of us really like that kind of thing. That's what makes the world go round. Everybody has their areas of interest and expertise. So we should never feel bad about handing them off. When things aren't going well, we should feel confident and comfortable saying, "This isn't going well. I think you should see one of my colleagues."
Yep.
That's what would also make the world, our future world, a better place, to not feel less than or belittled because we couldn't fix that. Big deal.
We've talked about the past, we've talked about the present, and Chris has alluded to the future. I want to pivot and continue down the future now. I'm going to start with a story. I had to pull up this post, but I'm going to read the post. It was posted on the Gout Support Group America 24 hours ago. PSA: if you have a TOFI, please see a doctor soon. My husband had struggled with gout for years now. It subsided since he retired. Allopurinol isn't a good option because the man is bad about going to the doctor. He's had a TOFI on his middle toe for several years. His toe had to be amputated. There was no joint or blood vessel left. We will see about nerves as the next few weeks passes. Take good care of yourself. People need to hear about it because there's still work to be done. Gout is the most inflammatory type of arthritis, yet it's totally manageable. The medication is very affordable. You can live pain-free. So why are 75% of the 12 million plus people living with gout not there? What still needs to be done? Where are we going? What's the future? What do we need to do?
Gary, one is I'm going to bring up is you picked Back to the Future. So I decided I'd research it a little bit last night. Here's the theme of Back to the Future: taking control and personal responsibility over your destiny.
I love it. I picked it because of the DeLorean.
Completely secret sauce right there. Kudos to you for picking Back to the Future.
Thank you for the insight. Very powerful. We do have control over our destination. Chris, you say that all the time. I love it. It's
And I
doable.
think our future is, if we're going to have success doing what we're doing right now, the Gout Education Society, the Gout Support Group of America, bringing the education to the patients. A provider is not knowledgeable in the area. This is not so complicated that they can't be helped by the patient who has a vested interest in success. But that's ultimately where we're trying to get to. And if we hit it from all directions, we hit the patients and we hit the doctors and the congressmen. Everybody needs to know how to do it so that no one will get missed in our future.
And continuing the activities that our advocacy groups have been doing, I think it's very important. There is a push these days, and I think it works well in certain countries. England especially has the data. They make the diagnosis by the physician, get started on medications. The algorithm of step increasing the urate lowering therapy, monitoring the patient, calling them frequently every 2 to 4 weeks to make sure that they're taking their medicine, that the uric acid's being tested on a regular basis, initially, maybe even every month when needed, and getting the patient to the point that they can see they've made a difference. Not only have you suppressed the uric acid, but you suppressed it for a long enough period that the patient's starting to feel better. And over a year or two of being on this medication, their symptoms are just gone. And you get to that stage, then you don't have to spend a lot of time convincing them to stay on the drug because it's needed for lifetime. I think that when it is the kind of way that chronic diseases are treated across the board, communication back and forth between the doctor's office.
My experience with lupus was that 30 years ago when I first got married, I would tell friends and people I came across that my wife had lupus and they didn't really even know what it was. Today, when you say my wife has lupus, they go, oh, yeah, I have an aunt or my sister or my mother or a friend of mine has it. Maybe 15 years ago, they'd say, oh, I had an aunt that died from lupus. I had a sister who died from lupus. So now I don't even hear that anymore. It tells me people are living with lupus better because of the treatments and medications that are available. But I think gout can take that same journey, to be honest with you, Gary. Today, your initiative is so important because social media is the vehicle. Hopefully, we'll be able to continue that work and get it out on social media.
Absolutely. I know time is up, so we're going to do quick fire real quick. As we wrap up, I want to leave our audience, whether it's patients, caregivers, or the healthcare community out there, whoever might be listening, I would like to give one call to action. What is it that you want to let them know? What's the call to action? We will start with Dave, and then we'll go to Chris, and then to Dr. Edwards.
My call to action is go see a rheumatologist and have your blood work done and find out what your levels are and move from there.
Great. Thank you.
Mine's just a story of hope. If you're getting beat up, you can solve this thing and then manage it for the rest of your life and be like Dave with great alacrity, enjoying a hamburger and a beer.
You notice I'm smiling, Chris.
I do.
Absolutely.
Take it seriously, but it's not just an intermittent disease making you miserable for a week every 5 to 6 months. It's something that's happening all the time, even when you're not having symptoms. It's affecting your blood vessels, worsening your diabetes, worsening your blood pressure. It's doing a lot of things that are going to impact not just your quality of life, but your quantity of life. And as you've heard over the past hour, it is exceedingly treatable, and you just have to be patient.
And Dave, I love the fact that you looked up Back to the Future and just you can control your destiny, be proactive with your gout management. Know the data, act on the data. Chris, it's completely doable. Living with gout can be pain-free. And that's a wrap. Gary.
Thank you, Dr. Edwards. Thank you, David.
It was a pleasure.
Bye now.